Hey guys, hi, welcome back to another stream. I was just catching up with my people on TikTok, but it's so good to be with you again tonight. I'm Dr. Sylvia, for those of you who are meeting me for the very first time, and I am a consultant in general practice. I'm based in the United Kingdom, and tonight we are discussing green tea and fibroids. So as you've probably seen in the description, or even if you haven't, we've been doing this series where we've been talking about the most effective natural ways for dealing with fibroids or for shrinking fibroids. And so the first week we talked about diet, didn't we? Then the week before last, we talked about vitamin D. I wasn't here last week because I was just explaining to people we had to be away for a netball competition. But this week we're talking about green tea. And I would love to hear your experiences, guys. If you wouldn't mind sharing them with me in the comment section, it will always be great to hear from you. Whether you've used green tea for dealing with fibroids, how effective was it? What was your experience? Okay, so we're going to get started very, very shortly. I always like to talk about I always like to remind you guys about the disclaimer for the channel. So let me just put it up here for those on YouTube, Facebook, and LinkedIn. You can see that rolling on the screen. And that is that we do not give health advice on the channel. We are here to discuss health information with as much evidence that we found from research studies, so it's as accurate as possible. And the entire purpose of the conversation is to hopefully give you some thoughts, give you some opinion that you can go ahead and speak to your own registered health provider who knows your medical background, who can examine you, organize tests, and so on for you. Hi, guys from TikTok. Hello, Inayat Gol. Hello, Hussein Tubangwa. Hello, Navi Max. Hi. Hey, Sam. Hi, Wednesday. Did I get that right? Waynes. Yeah. Hi, Agnes. Hi, John Johnston. Hello, Fud. Thank you so much, guys, for joining. You can see the topic of the conversation tonight. So I hope you guys will chip in. And just to remind you, I can get rid of this now. And just to remind you guys that, yes, we don't provide advice, but if you have issues that you do want to have a conversation about, if there's something that you want to get some more direct or in-person guidance on, then by all means, I'm happy for you to contact us via our email health information service. And I'm going to share the screen for that in a moment. I'm just looking for, is that it? Yeah. So hopefully you can see on your screen, for my people on YouTube, LinkedIn, and Facebook, you can see the Askawayhealth website. If you scroll down to the middle of the homepage, you get to the email health information service. For guys on TikTok, it is simply askawayhealth.org. Go to the website if you need to send a health inquiry or question. Go to the middle of the page and it will show you the button, ask me a question. Click on that. It takes you to the next screen where you can put in the details of your inquiry, send across to me and my colleagues, and we can look at having a conversation that will hopefully provide you some direction that again will help you, empower you to go and speak to your health provider about. So without much further ado, as they love to say, let us start with ECG, EGCG, and green tea. So what is green tea? Let me just leave that on the screen for people on YouTube and Facebook and so on. Okay, so what is green tea? So green tea is also known as unoxidized tea. Okay, so it's tea that's different from the usual black tea that we have that we mix with milk. So it's tea that's not been oxidized, that comes mainly from the leaves of a plant called the Camellia sinensis plant, which I always forget that name. I always have to check it up, but it's such a lovely sounding name, isn't it? It makes you think of an exotic flowering plant. And I didn't bring any photographs, I'm sorry. But anyway, so green tea comes from that. It's not oxidized, so it doesn't undergo the same oxidation and what they call withering processes. And if you're people that make tea, if you're involved in that, tell me what that process is like. But anyway, this is how green tea comes about. They don't oxidize it. It doesn't go through the withering process. So it has a unique flavor and a higher antioxidant profile compared to black tea. Let me say hi to the guys on TikTok because it's getting quite busy. So it's asking me to swipe. I don't know why it wants me to do that. Anyway, so hi Cecilia, hi Manu Hakim, Please share this live. Hi, David, who's just joined. Please share this live. We are talking about green tea, and I'm looking forward to any comments that you guys have around your experience using green tea, especially for treating fibroids, maybe for other things, because green tea has been shown to have benefits for other health issues. So let me know what your experience is or experience has been. Let me say hi to somebody from YouTube. Hi, Tracy Jackson. So Tracy says, hi, I drank green tea and I have fibroids. Tracy, thank you so much for watching, for contributing to this. Let me take this. Yeah, Tracy, thank you so much. I really appreciate your popping in and sharing that. And I would love to know more because I always say that we all have different experiences. And I think it's very true that what might work for one person might not necessarily work for another, especially when it comes to using natural measures or options and supplements. I would love to know your experience, how it went. What was your experience? I don't want to lead you in any way. What was your experience? But thank you so much. I really appreciate your popping in. Tell us what it was. If you've got any questions, please share them in the comments section as well. Okay, so we've said green tea. This is a type of tea. It's high in antioxidants, and one of the most important ones, I think the most important ones, because there are different types of catechins that you find in green tea. But the key one is the EGCG, which is the epigallocatechin gallate. Try saying that 3 or 4 times quickly. But it is epigallocatechin gallate. And so that's the most, that's the one that's the highest antioxidant effect or property that we know for green tea. And antioxidant is important because when we think about fibroids and how they form, we know that there is an element of inflammation. We know that, of course, there is the background of hormone imbalance, but there is also some thinking that there is something to do with high chronic inflammation going on, high oxidative stress going on. And so something that can contribute to bring that inflammation and oxidation down can only be of benefit to people who are who have fibroids. Hi, Ellie at Stitch. Hello. I wonder what happens if I tap that. Okay. Oh yeah. Hi. Okay. Hi, Cecilia. Okay, right. So anti-inflammatory, what does that mean? I think I've just explained it a little bit. So it might help with heart, joint, even bowel conditions, where you're talking about green tea now. It might help as an antioxidant, I've just explained, so helps to prevent cell damage. There is some research or some conversation around helping to prevent cancer. Lots and lots of work needs to go into that. But just bearing in fact that a lot of cancer is process, involves oxidative stress, involves chronic inflammation. You can see why there seems to be a link between preventing cancer and green tea. However, we need a lot more studies in that. So I don't want people to just go away and say, oh, right, if we take green tea, we're not going to develop cancer. We're not at that stage at any point. We're not at that stage. And so I think it's really important for us to have that, to bear that in mind and just to keep that in context. Okay. So let me just, where is this? Let me just take this off. I'm just hoping that Tracy will get back to us and share her experience. But anyway, so green tea may also protect the liver and help with weight loss. So there's quite a few different reasons that people would like to take green tea. Hey, Ellie. Thank you so much for joining. Hi, Constantine. Who else? I think I'm caught up. It's going quite quickly. Anyway, so that's in sort of a brief introduction to the benefits of green tea, why people take green tea. Very, very, very old method for helping to detox, to cleanse, considered to be healthier than other sort of beverage options, like your usual tea, coffee, and so on. So this is where we are with green tea. Okay, so what about when it comes to fibroids? Because that's what we're particularly interested in. How does EGCG in green tea help reduce fibroid growth? Now, I don't know if you guys are seeing me or seeing my screen. I haven't even done a sound check because I don't know if people, and I can't do a sound check because I'm using my other phone for TikTok. I can only just hope and believe that you guys can hear me. Anyway, how does EGCG? If you can hear me, please let me know in the comment section. Somebody save me. Okay, how does EGCG in green tea help reduce fibroid growth? Guys in TikTok, so I'm sort of reading off my slides, which I have in front of me. Because I'm sort of doing multi-streaming on one device and then sort of looking to you guys. So I'm sorry that I can't share the slides with you. But when I'm sort of looking in this direction, that's all I'm doing. And so the folk on Facebook, LinkedIn, and YouTube should be able to see that because I've selected for them to be able to see my screen. So they should be able to see that. Anyway, so this EGCG, that is the major catechin in green tea, we've seen that it's got several benefits or biological effects. So we've talked about being anti-inflammatory, and we've said that even though we don't know the full causes or how fibroids develop, we have over time come to figure out that it has something to do with hormone imbalance. It has something to do with, our diet. It has something to do with environmental exposure, perhaps to EDCs. It's got something to do with chronic inflammation that we don't know when it starts, perhaps in the womb or, or outside the womb. So many different potential theories. So here is something, EGCG, which has anti-inflammatory benefits. So we can only think that it would have some benefit on treating fibroids. It also has anti-proliferative biological effects, which means that it can halt or prevent growth or multiplication. Proliferate means to multiply. So it could potentially block the proteins which help fibroids grow, the connective tissue, the matrix that helps fibroid structure to grow, and it could promote the death of those fibroid cells. And then the other thing, like we said, is it's got antioxidant effects. So because we believe that oxidative stress can contribute towards the growth of fibroids, those properties of EGCG in green tea can potentially help to remove or neutralize free radicals, further reducing inflammation and other conditions that encourage fibroids to grow. So those are the ways, those are the biologic effect that we think EGCG in green tea can have in how it will work or how it will prevent the growth or development of fibroids. We think it may also have something influence how estrogen behaves. So it might influence the hormonal environment. So it might do something to that balance where we think that because of excess estrogen and other hormones, it could what's the word now? It could reduce the imbalance. It could stop that effect of excess estrogen, and so it could inhibit or it could prevent the growth of fibroids. So there are a few different ways that we think EGCG could do these things. So let me say hi to a few more guys that are just joining on TikTok. Hi, Dope232. Hi, KT4444. Let me say hi to you. Hi. Hi, Coco and Hearts. Hi, Ebrima267. Hello, Nono Fumogapi. Did I get that right? Hi, thank you so much for joining. Let me know your thoughts, please. It's not just me talking to myself. I really want to know what you guys are thinking around green tea and fibroids. Are you a skeptic? Let me know if you're a skeptic. I really want to hear from skeptics around this, and let me know why. Is it do you just think this is all balderdash, or do you just think where's the evidence, or what? I would love to hear from you guys. Okay, back to my people. YouTube, Facebook. Hi, Tracy. Hi. Oh gosh, fantastic. So Tracy says, I have seen a change in my weight and my body. I have more energy and I'm less stressed. Oh, well done. Good. I'm really so happy for you. And I don't know if there's anything else that you're doing. Is it just do you think this is all down to green tea, Tracy? That's my first question. Do you think it's all down to the green tea? How long have you been taking it? How long before you noticed this change in weight and your body? And are you seeing any effect on the fibroids? And I'm sorry to put you on the spot, but if you're happy to share, it would really be great to hear from you. Okay, right. While we sort of work on that, guys, on YouTube, Facebook, and LinkedIn, let us just take a quick break, and then we'll go to the next issue we want to look at for green tea. About green tea. We know what green tea is. We know it's one of the, in fact, if not the most potent antioxidant component of green tea, which is a type of tea that is not oxidized. So we're just looking at how is green tea different from other types of tea, and what is it about green tea that makes it so special, in terms of fibroids. So we've sort of laid the stage or set the stage with that bit of information. Let me see what my next slide shows. We've done that, so we're here. Okay, so those of you looking for the evidence, and I'm really looking for people that will say, Dr. Sylvia, where is the evidence? I hear you. For my people on Facebook, LinkedIn, and YouTube, so hopefully you guys are seeing my screen. Okay, I have 2 studies I want to share. I just found 2 because I didn't really have too much time to sort of go delving. There may be more, and I'm going to put the link to these studies in the description box, particularly on YouTube, for you to have a look if you really want to sort of go through the detail. And I've just got a bit of a summary here, but this is to show that there is, some people have worked on green tea, and I think it's really important that you do work on this, and it's not just sharing evidence, or this person said that or that person said that, which that is not bad, but if you can have a structured way of looking at this treatments, the same way they do trials for medicines and drugs, and then they determine, this is how effective it is, and these are the side effects, and this is who it's good for, this is who it's not. Thank you so much for liking Lumaf collection. Thank you. Hi. Thank you so much. You're a star. Thank you for doing that. I appreciate that. So many love hearts. I appreciate that. Okay, so I got 2 studies. And hi, Mikey. Thanks for joining. Thank you, Lumaf Collection. You are the MVP. Okay, so let me focus. So the first study I have is an old one, 2013. And it's a collaboration between a US clinician, and the main study was done, I believe, in Egypt. And they looked at, initially they were hoping to look at 39 women. Eventually they only had 33 that were actually taking the treatment. But it was a study where they were able to compare women who were taking the specific treatment, that is the EGCG, compared to those who were not. So that's a good kind of study where you want to compare similar groups of people, but they have different experiences. They have different, you're giving them different treatments. So there were 33 that eventually were in the treatment group, that is those that were having the EGCG. The average age was about 41.5. It ranged from 25 years to 50 years. And the average BMI in terms of size and weight was 33. It ranged from 21.9 to 48.4. So that's quite a big range in terms of the different types of people. You had sort of fairly young people, and then you had those that were around menopause, and then you had people that were well within a normal BMI, and then you had those that were had quite large BMIs. I mean, the downside, of course, that you quickly pick up is that this was a small study, just 33. So you have to ask yourself, how much of this can we actually rely on? But let us start somewhere, is what I usually say. Okay, so in this particular study one, what did they do? They gave each of these women 800 milligrams of green tea extract. Green tea extract. So that's extract of green tea. It's not just green tea that you get from the leaves and you just put inside. This is actually put in some hot water. No, this is the extract of green tea. So really important to differentiate it. And that is about 45% EGCG. And they took this every single day for 4 months. Okay, and it was administered to these women who had symptomatic fibroids, meaning that not only did they have fibroids, they had symptoms. Remember, if you've watched my videos and I've talked about fibroids, remember we've said that majority of women with fibroids don't show symptoms, but there are about 30% that will have symptoms enough to cause problems. So again, this is an important factor. They didn't just pick anybody, you have fibroids, okay, join the study. No, you have fibroids, but do you have symptoms? And then they confirmed those fibroids. So they knew the size of the fibroids to start with by doing ultrasound scans. So those are important features of the study. So like I said, I'll put the link in the description box that you can go and join. Hi to Sweet Juice. Hi CW Weston. Hi King Richie. Hi TikTok. I'm not sure who's TikTok. Really? That's interesting. Okay. Well, hi, welcome. And hi Lumaf Collection. Thank you so much for doing what you do. You are truly the MVP. I appreciate you. Okay, so In this study that was done in 2013, what did they find? There was reduction in total fibroid volume. They said there was reduction in fibroid-specific symptom severity. That means symptoms that you could directly blame the fibroids on reduced after the 4-month taking 800 milligram green tea extract every day. They also noticed that they had less anemia, so their blood levels improved. And they also noticed that not only did the blood level, hemoglobin level improve, they also noticed that they lost less blood. Oh my goodness, there must be a better way to say this. The amount of blood they were losing in terms of bleeding was less for those people taking the green tea. And importantly, they said they did not observe any adverse effects. They didn't observe thickening of the womb lining. They didn't observe any other womb problems. This is what they stated. Okay, so bearing in mind, this is a fairly older study. It's about 11 years old, yeah? Still, it's a reported study. I mean, the bottom line, like I usually say, is that we need a lot more studies into this kind of things that would really help us in terms of what we can learn from, what we can gather from these. So that's the first study. I'll let you chew on the study. Let me know what you guys think. Do you have any problems with this kind of study? Are you also, like me, thinking, not enough people? Does that strike you? Is there anything else that you'd have loved to see about the age? Do you think the age was reasonable? So they went from women 25 years old to women who were 50. What do you think? What about the weight? So, I'd love to hear back from you guys. Hi, Ricky Rogers. Hi, thanks for following. Hi, Organza. Hello. Hi, iPad 2028. And hi, my friend Lumath Collection. Hi, Rodabod. Hi, Darkus IG. Okay, so while you're chewing on that, let us see. Hi, Tracy. Thank you so much for coming back. So let me get this off for a moment. We've done study 1. So Tracy said, yes, it had an effect on the fibroids. They're getting smaller. Amazing. Wow, that's amazing. So is that from ultrasound? Is it that you've been seeing your doctor, they've been doing your ultrasound, they've been measuring the size of the fibroids? How is it going? And she says, I've been drinking green tea for about 3 months now. Well done. Well done. Okay. You've been having your green tea for about 3 months. How much are you taking? How are you drinking it, if you don't mind my asking? So what I mean by that is, are you brewing your tea at home? How many cups are you having? Are you taking supplements? I'm very, very curious. I'm very nosy. Guys, again, let me say something that's really important, because I know it's exciting to have somebody sharing their experience, and that's amazing. It's valid. Remember that one person's experience may not be exactly the same for you, okay? It is not medical advice. This is the experience that Tracy shared, and I'm excited for her, because if she's feeling better and getting better, that's the point, isn't it? That's what we need. I think it's important that we have wider, bigger studies that tell us the effects of all these different treatments. You and I watching and doing this series that we started 3 weeks ago are looking at natural measures and just trying to explore and see what's the truth, how reliable are these things. And I said at the beginning, what might be okay for somebody, what might be effective for somebody, may not be effective for someone else. And before you start or embark on any endeavor or any treatment, please speak to your doctor. Please talk to your doctor. Really, really important to do so. Okay. Here is Mia Michael. Hi, Mia. Thank you so much for joining from Papua New Guinea. It's great to see you. Thank you so much for joining. I appreciate your commenting. What are your thoughts around green tea and fibroids? Please let me know if you want to contribute. You're very much welcome. And Tracy says, I had a biopsy done. They found no cancer in my womb, in my uterus. Thank you, Tracy. Okay, so we have just looked at one study. For those of us who are skeptics, who think it's all balderdash, all these natural things, there are studies. Some people have actually sat down and done studies. You can quibble about how effective the studies are. You can make noise about the quality of the study. You can make noise about how big the study was. Yeah, we can do that. But at least it's a step forward. But I've got a treat for you. Not only do I have study, I have study 1 and I have study 2. So here's study 2. Again, this is a study that you guys hopefully on Facebook, LinkedIn, and YouTube can see my screen. But for my guys on TikTok, I'm going to read out to you. So this is study 2, and this is 2021. So a more recent study. This was carried out in Italy. And again, I will put the links to the study, the URL. I'll put that in the description box once I've done with the video. Now, this study looked at 16 women. The average age was about 40 years on average. I don't know what the range was. And the average BMI, I don't know. I don't know if it was reported, but certainly the little aspect of it I was looking at, there was no comment on the size. I mean, why is it important? I think it's important to document that because we know that women who are overweight or obese tend to have a higher frequency of developing fibroids, or to put it in another way, being overweight or obese is one of those factors that are associated with developing fibroids. But anyway, this second study, okay, treated these women with EGCG 300 milligrams. Remember that study 1 gave them 800 milligrams of green tea extract, and they said that was 45% EGCG. These guys are talking about treating with 300 milligrams EGCG, but not just that. They also gave them vitamin B6 and vitamin D for 90 days, for 3 months. So this was a slightly shorter study, but not only did they give EGCG, they gave some other things. And if you watched my vitamin D video, you know that we've talked about how effective vitamin D is. 37 new messages. Oh, okay. Interesting. Oh, hi. Hello. Thank you so much for joining. Appreciate you guys. Hi. Hello. Hi, Bobo. I'm just trying to read everybody. Hi, Margaret Heron. Hi, Shemarie. Hi, Aspin. Hi, Joseph. Hi, Unique. Hi, DXS. Thank you so much, guys. Really appreciate your joining. And I'm waiting for a question from TikTok. Guys, please let me know if you have any thoughts or anything you want to comment on. Okay, I'm just going to quickly read out the study results and I'll come back to you guys in the comments on YouTube. So, this second study, we found from our first study very exciting results, okay? They talked about the fibroid volume reducing. They said the amount of blood flow was less. They said the symptoms were less severe. They said those that were anemic, they were no longer anemic. All really, they even said that there were no adverse effects. Amazing. So in this second study, they said, again, reduction in the total fibroid volume. Now, I forgot to mention that this second study, they actually talked about the type and the size of fibroids. And in fact, if you want to know more, I do have a dedicated video where I actually broke down this second Italian study, and I will link it in the description because I think it's quite impressive, even though it's very small. It's a small study, but I thought it was really impressive the way that they looked at specific types of fibroids, the intramural versus the subserous fibroids. So they said that they noticed a reduction in fibroid volume that was more for the intramural fibroid compared to the subserosal one. They also found that the length of menstrual blood flow was less. So women who used to have very long bleeding, their bleeding was reduced. The length of or their duration of bleeding was reduced. They said that these women who took this cocktail of EGCG, vitamin B6 and vitamin D were very satisfied with the result. They really were happy with the treatment. Again, they did not report any adverse effects. They didn't see anything different in terms of the volume of the ovary. They didn't see any womb thickening or thickening of the lining of the womb. They didn't report any adverse events. So we have two studies, sort of 10 years apart, and there may be more. Like I said, I just picked out these two. There may be more studies, but we have two studies done to a fairly decent quality, reported in quite strong journals. The only quibble, or one of the quibbles, not the only one of the quibbles, I would say, is just the size of the study, indicating to us that a lot more work needs to be done in this area. But it is telling us, my friends, that there is something with this EGCG. That's what it's telling us, that there is something. And let me go back to my comments here on YouTube, because, we have Tracy, who is very kindly telling us about her experience with, with green tea. So she says, Okay, so let me do it in order. So Mia says, tell me more on green tea so I can take it. So Mia, we are having a conversation, like we're trying to explore the benefits of green tea. And I keep saying, while you might hear, oh, this is how much I'm taking or how much that person is taking, please speak to your own medical practitioner, okay? They know your medical background. They know what other medication you're taking, what other conditions that you have, and can advise whether it is suitable for you to have green tea or not. Not me, not Tracy, not anybody else, okay? So hi, Joy. Let me say hi to Joy. Hi. I don't want you guys on TikTok to think I'm ignoring you because I'm not. I'm not. Okay, so Gus Whittle. Oh, wow. Okay, so let me say hi to everyone I can say hi to. It goes so quickly and I miss, wow. Hi, Judas Cakes. I think I have said hi to as many. Oh, I missed that one. Hi, Anifa. Okay, I think I'm up to date. Fine. Okay, so Mia, please, let's have that at the back of our mind, okay? But back to Tracy. Tracy says, yes, I'm brewing at home, and I drank 1 cup in the morning, and I'm taking vitamins D2, okay? And Tracy said, I did an ultrasound and they said I had a large fibroid and 2 small ones. Wow. I'm really encouraged by what you're saying. And I really hope that you continue to experience improvement. And, I think what I love in particular was your first comment. You've seen a change in your weight, in your body. You have more energy. You're less stressed. That all sounds amazing. Okay. All right, guys. So we have talked about, hang on, let me find my place here. So let me find my place here. Okay. So we've talked about green tea. We've talked about its general benefits. We've talked about how it could work in fibroids. And we've just literally had a look at 2 studies. So 2 academic research work that doctors, clinicians have carried out looking at the effect of green tea and fibroids, and just clearly looking at alternatives, perhaps for women who cannot have some of the hormone methods that we use to treat, or women who do not want to use the hormones or do not want to go through surgery and so on. I think it's important to also have that conversation for that group of women. So let's just take a quick break, guys, on YouTube, Facebook, LinkedIn. Let's take a very quick break, and then we will look at another couple of things around EGCG. Now we're going to be talking about dose, what's recommended, how much, and so on. And I will be right back. What you want to say to your doctor, or what your thoughts around green tea. If you find it useful, please give this video a like, and share it with your network as well. That would be really amazing. And the same to you guys. I mean, you guys know the drill, but please like the video if you're watching, and if you're watching on replay as well. Let me know your thoughts in the comment section. Always welcome. I do try to respond to as many as I can. But reminded that it is not for the purpose of medical advice. It is just for giving you information that you can use to sit down with your own provider and have a conversation, have a useful conversation. Okay, so drinking green tea, right? Let me see. Is that one or this one? Okay, let's talk about the dose. So the question is, which is more effective, drinking green tea or taking supplements that you can get from the chemist? We've just heard from Tracy, and Tracy's sharing her experience, which I really appreciate. She says to us that she's brewing at home, drank 1 cup in the morning, and she's also taking vitamin D. And we have studied this, and we think for somebody who is interested in shrinking her fibroids, going the natural route. These are a couple of methods that do show some scientific evidence of having some benefit in doing just doing the trick. To what extent, we don't know. We need a lot more study, but I'm really glad that she's getting some encouraging results. Now, there are some challenges with taking green tea, with drinking green tea, so getting the tea leaves at home. Challenges in the sense that there are so many different brands out there. So nobody can actually recommend to you which brand to take, which concentration, because they're all quite different. So anybody who's saying to you, oh, take this particular one, you really have to be reading the fine line. You really have to be reading the print. You really need to be reading the back of the box so that you know exactly how much that you're taking. That's what I'm trying to say. So on the screen, on the slide, you see that I've talked about concentration can be different, the varying amounts of EGCG, or that's supposed to say EGCG, in different teas depending on the brand. And then, of course, similar to supplements, actually, because some supplements contain very small amounts of EGCG. There's some that will have an effective amount in one tablet of 10 milligram or 7 milligram. Well, there are others that could have up to 100 or 200, milligram of EGCG. It varies, okay? But in a cup of green tea, which is, say, an 8-ounce cup or half a pint cup of green tea, you could get between 50 to 100 milligrams of EGCG. So you see, it's quite a big gap, isn't it? So that's why I said you have to look at the back of the packet to know in each sachet effectively how much EGCG am I getting, and then you know what quantity that you're actually consuming. Okay, so this is just popped up from Tracy. I'm experiencing the thickness of the womb wall as well, having heavy periods that won't stop, but I'm about to have surgery done. Okay, I mean, I think that would be interesting. I don't know if that's related to since you started taking the green tea, or if it's something that's pre-existing. Tracy, that's interesting to know. But you said you're about to have surgery done, so hopefully some of these things will come under control. Okay, so like I said, in terms of how much, supplements can sometimes provide 300 milligram per dose. Depends on the supplement. It depends. Most studies on fibroid treatment use high doses that you can really only effectively achieve with the supplements. Because if, for example, you want to get the kind of high doses that we talked about in these 2 studies I just shared, you might be drinking a lot of green tea. That is a lot. So sometimes it may be more effective and more practical to just take the supplements. But what is most important, and that's why I've underlined it here, is that it has to be under medical supervision. Hi, is this Olola Kende? Is it Oriola? I'm so sorry. I can't see it properly. Hi, Kende Oriola. Hello. Thank you so much for joining. I'm so sorry I was missing about your name. It was not intentional. Okay. So those high doses should be under medical supervision. It's really important. So please don't be carried away because you've seen, they took 300 milligram or they took 800 milligram. It's under medical supervision. And I will talk about why that is so important. And then green tea extract, which is very concentrated, if you like, green tea can contain anything, I beg your pardon, between 500 milligrams to 1,000 milligrams of EGCG. So what is the quantity? Now, generally, people drinking between 1 cup to 4 cups of green tea generally are fine, as long as they are not sensitive to any of the, components like caffeine, because green tea still contains caffeine. And you can't be going around taking all that green tea and not thinking it would not have some effect. The caffeine could potentially cause side effects. So that's why it's also important to be conscious that even though we say it's a very potent antioxidant, it still contains elements or chemicals that could still cause harm if they're taken at very high levels. So we would usually recommend that you stick to between 2 to 3 cups of high quality green tea a day if you want to maximize the benefits. Okay, so those benefits that we talked about at the beginning, we talked about things like anti-inflammatory benefits, especially for heart health, for your joints, inflammatory bowel conditions, helping to control weight, helping with different types of conditions that green tea is known to be effective with helping. For some people talk about helping to monitor blood sugar, helping just as a cleanser or as a detox, as an alternative to taking black tea with milk and other beverages that we take on a day-to-day basis. Usually 2 to 3 cups a day is thought to be adequate. Okay, so I think we have sort of answered the question, but let's just bring it to a close, tie it up and see what are we doing with green tea and fibroids. Does it help to deal with those symptoms like heavy bleeding and pain? We have 2 studies that suggest, so from a group of women that took fairly high doses of the EGCG in green tea, that it did make a difference in terms of their symptoms. It controlled bleeding, it controlled how long they were bleeding for, it controlled how heavy the bleeding was. It even to some extent helped to reduce the volume of the fibroids. They talked about not experiencing any side effects. So positive feelers from those studies. There are downsides, because I think it's fair that we look at both of them. There are downsides. They said, oh, these are small studies. And then my question would be, well, what type of fibroids did they have, these women? What kind of fibroids were they dealing with? The kind of things I think would be really important to ask before we can say this particular treatment would work for every other person with fibroids who wants to use it. And guys, if you're responding on the replay and you've got other studies that you've seen, please feel free to share them with me. I'd love to see them from you as well. Okay, the other thing to note is there any risk associated with taking EGCG supplements, especially at those high doses for fibroid treatment? So it's important to say that if you are regular on my channel, you know that even though I talk about these supplements and the potential, some supplements and their potential value when it comes to fibroids, I always say, please never assume that because something is a supplement, therefore it is healthy. That is not true, because they can have certain health risks. In the last few months, I've had a number of calls. I've spoken to a number of people who are using, some weight loss injections, for example, or just using some weight loss supplements, not weight loss injections, weight loss supplements, and they've called because of side effects and maybe irritation of the tummy, experiencing lots and lots of diarrhea, and just being unwell because of those supplements, those weight loss supplements that they thought were natural. So they can cause some problems, and those problems can be compounded or worsened if you have other medical conditions or you're taking other drugs. So in particular, high doses of EGCG, they've linked that to liver strain or liver damage, which is why it's important to speak to your doctor first, because if you don't have a liver that is working fine, EGCG could make it worse. So please have a conversation with your doctor, okay? Even when you're taking it on a regular basis, after a few months, 3 to 6 months, it's worthwhile going to speak to your doctor, speak to them about, how you're getting on. Let them ask you questions to monitor your liver health, look at doing any blood tests if they think that is necessary. Really, really important. So people that we have advised to avoid it are people who've got liver disease, kidney disease. It shouldn't be taken by pregnant women, shouldn't be taken by individuals on certain medication, like those that we use to treat high cholesterol, like statins, and some heart medications like the beta blockers, like bisoprolol, for example. So be conscious. Let's be conscious. Let's be safe about using these medications. Okay, so I wanted us to have that conversation around EGCG, look at both sides of the coin, its benefits, any risks, and what are the issues around the doses that we're recommending for people. So I hope you found it useful. Thank you so much to guys that have joined me from YouTube, Facebook, and LinkedIn. I appreciate that. And thank you so much for those watching on the replay. Please don't forget to like this video and to share in the comment section your own experiences. Thank you so much to Tracy. I really appreciate your time and giving us some insight into your experience, and I really hope that your surgery or procedure goes well and that you continue to improve and feel better. Okay, and thanks to Mia for popping in with a couple of questions. I hope you found the conversation useful and that you can use that to go back and speak to your doctor about any questions that you want clarifying. Thank you so much to everybody who's been watching. Let me know if you found it useful, and I will see you again in the next live, which should be next week. And I think think we're talking about curcumin. I'm not sure, but I think that's what we're talking about. So if you're curious about curcumin and how effective it could be in terms of managing fibroids, I'm going to look for studies. You guys know me. I'll go and dig and find out what do we have that, you know, people have actually studied and what does it tell us. Then please join me. But let me know what your questions are and I'll see you in the next one. Take care, guys. Hi, I'm Dr. Sylvia. I'm so excited you're here. In this video, you'll get excellent health tips that will make a real difference. But that's not all. I also create personalized guides, tools, and plans tailored to your specific needs. These resources will help you reach your goals faster and more effectively. Don't miss out on your free copies. Check out the links in the description box below. Before you watch this video, please like and subscribe to the channel so we can continue this health journey together. So, let's get started. I'll see you in the rest of the video.